This guide is presented to assist you with the setup of your home sleep study using the Compumedics Somte PSG system. The Somte is a recording device that will monitor your sleep and breathing in the comfort of your home. The Somte is designed to provide freedom of movement while acquiring all signals as if you were in a sleep clinic. We recommend wearing loose-fitting clothing under the device and setting up the unit 30 to 60 minutes before going to bed. Your kit will contain all the components to use overnight. It will include the recording unit, the interface module, electrodes, leads and snap-on pads, nasal cannula, pulse oximeter, effort belts, alcohol wipes, application paste and tape. The white recorder contains an LCD screen and a status light. The patient interface box, or PIB, contains all the necessary inputs for your sleep study. Your technician will have inserted the leads into the PIB. Please use the labelling on the device to follow where leads are positioned. Please do not disconnect any leads. However, if they are loose or not connected fully, gently insert the connector into the correct input as shown. The PIB contains all the inputs required for your study. Starting on the top left, we use EMG plus and minus, EEG 1 plus and minus, EEG 2 plus and minus, the limb lead. On the top we use EOG R, EOG C and EOG L. On the right side, ECG plus and minus, a ground input, negative, thoracic and abdominal effort, and the last two are the oximeter and the nasal cannula. Prior to applying the electrodes, we ask that you do prepare the skin. This involves wiping firmly with the supplied alcohol prep pad and allowing it to dry. Using the supplied preparation paste, firmly rub in a circular motion using the applicator. Please be sure to rub firmly but not so hard to cause irritation. Please do not exceed the size of the electrode itself. We also ask when done to wipe away any excess paste. When applying the electrodes, we recommend using a mirror to assist in the correct locations. We recommend attaching the device as shown using the respiratory belts. It is preferable to wear the device on the outside of clothing. The grey PIB sits on the top belt, with that belt going around your chest and approximately 2 centimeters below your armpits. The white recorder sits on the lower belt, which is then located around the midline of your stomach. Please tighten the belts to ensure a snug but comfortable fit. The white belts shown have a small metal hook built into it that will latch back onto itself when folded over to tighten. There is also a small plastic clip supplied that will help to secure it in the correct location once you have folded it over. Again, we ask that you make sure of a snug but comfortable fit. You may also be supplied a set of black reusable bands. These have a simple clip-on electrode with an adjustable strap to tighten. When fitted, simply slide the band around so the clips are facing the front. The grey PIB sits on the top unit, while the white recorder sits on the abdominal with a small plastic flap to hold it in place. We do recommend using a small bit of tape to help secure it in place for the night. We start the head electrodes with the labelled ones of F3 and F4. Apply the snap-on electrode pads to those leads. The green F4 is positioned as close to your hairline, in line with the outer edge of your right eye. This wire then goes behind your right ear and connects to the EEG1 minus input. The black F3 is located on the left side, again as close to the hairline, but this time in line with the outer edge of your left eye. This lead is connected to EEG2 minus input. We do recommend using a piece of tape to help secure it. The next two head electrodes sit behind the left and right ear and are labelled as M1 and M2 on the head. Again, apply the snap-on electrodes to these leads. The electrode pads are placed behind each ear on the bony prominence just below the hairline. The green M2 is positioned behind your right ear and connects to EEG1+. The black M1 is positioned behind your left ear and connects to EEG2+. Again, apply tape to secure. The head electrodes, again used to measure eye movements, are labelled as EOG-R, EOG-L and EOG-C. Apply the snap-on electrode pads to these leads. The blue EOG-R lead runs up behind your right ear and is placed approximately 1 centimeter out and 1 centimeter up from the outside of your right eye. The second blue EOG lead then runs up behind your left ear and is placed approximately 1 centimeter out and 1 centimeter down from the outside of your left eye. And this is plugged into EOG-L. The final purple lead, EOG-C, is positioned in the center of your forehead. The final head electrodes are EMG-R and EMG-L. The orange EMG-R pad is placed approximately 1 centimeter out from the point of your chin on the right side. The second EMG-L pad is placed on the left side, approximately 2 centimeters from the first electrode. Again, secure with tape. If facial hair prevents that positioning, we do recommend placing the electrodes along the cheeks, just above the hairline. To find that location, place your fingers along the jawline and clench your teeth. The electrodes are positioned where the muscle is found to be most active. If possible, leave a gap of approximately 2 centimeters between the two electrodes. To measure heart rate overnight, we use two ECG leads connected to ECG plus and ECG minus. The ECG plus lead is located on or just slightly below your left collarbone, while the ECG minus lead is located on or just slightly below your right collarbone. Please ensure there is minimal to no hair underneath the electrode pad. The two bands, as previously mentioned, contain the thoracic and abdominal belts. The adjustable thoracic band wraps around your chest and is adjusted to ensure a firm fit. Again, placement should be approximately 2 centimeters below the armpits. Attach the yellow lead from thoracic or THO onto the snap buttons on the upper band. The abdominal band sits around the midline of your stomach. Again, ensure a snug but comfortable and firm fit. Attach the blue lead from ABD, ABD, onto the snap buttons on the lower band. The nasal cannula is used to measure breathing and snoring. Remove the cannula from the disposable bag and insert the prongs into your nostrils, ensuring that they bend towards you. Place the loops over each ear. Slide the toggle up under your chin to hold the cannula firmly in place. Place some tape over both cheekbones to help secure the cannula, but please do not squeeze the tubes flat. Firmly screw in the other end of the cannula into the port shown. Please do not over tighten. When applying the tape, please move the cannulas around to make sure they are reasonably comfortable. The tape is to prevent them from falling out, as we do require this signal to be consistent overnight. The pulse oximeter is a silicone grip that can go onto any finger of either hand. We normally recommend the non-dominant middle finger, but please try a few to see which one feels more comfortable. When inserting your finger, make sure it is at the end of the device and not pushed all the way through. Please ensure you do not have nail polish or acrylics on, as this will interfere with signal quality. The cable runs across the top of your finger along the back of your hand. We recommend taping the cable around the finger and again on the back of the hand to prevent it from slipping off. The oximeter may already be connected. If not, firmly push the other end into the PIB as shown. When recording, there will be a small red light at the end of the probe. The leg electrodes are to measure limb movements. This is a split lead that plugs into the limb port. For comfort, it may be easy to place the leads down your pants and locate on both legs. The positioning is below each knee and on the outer side of your leg. To ensure the correct location, flex your foot up and down and observe where the muscle moves the most. This is the ideal location. We recommend a small piece of tape over the electrode pad and then a second piece after forming a small loop to prevent any strain. The last electrode is the ground electrode. plugged into negative. This can be positioned to any convenient location with a suggestion of behind the left or right shoulder. It is important to place it at least 5 centimeters away from any other electrode. Now you have the device set up. If the unit is set to pre-record, your technician may have pre-programmed the unit. In this case, the unit will turn on at that time, the Somte logo will display and the device will start recording. A status light will change from flashing yellow to green when it is recording, and as mentioned, the oximeter light will come on. If you are required to manually start the device, turn on the unit by pressing the left power button. Once the logo appears, the screen will change to a picture of a person. Press the middle button once, and when Start Recording shows, press the middle button again. The status light changes from flashing yellow to flashing green. The second indicator again is the oximeter light, which will be a faint red. Now the device is ready to record, you may go to bed when ready. During the night, please feel free to move around and get up if required. You do not have to disconnect the device or any wires. If you find any equipment uncomfortable, please readjust as needed. If you notice any leads have fallen off, please reapply and tape as necessary. After the recording is completed, please remove all electrodes and the bands from yourself and place in the supplied bag. And return to your testing center as advised. We hope you sleep well and this has been helpful. Please feel free to replay any sections that remain unclear or refer to your setup guide.